Union test preps. Trauma practice test for the NREMT exam.
There will be a brief pause after answer choices are given. This is a great time to pause the video to solve.
Question 1. Your EMS unit is dispatched to an auto versus pedestrian incident in front of an elementary school. Upon your arrival, you find an 8-year-old male who was thrown approximately 25 feet after being struck by a vehicle traveling 30 to 35 miles per hour. You assess the patient's level of consciousness using the Glasgow Coma Scale. The patient opens his eyes to painful stimulation, has incomprehensible sounds, and withdraws from pain. What is his Glasgow Coma score? A. 15. B. 8. C. 6. D. 10. The correct answer is B. 8. The Glasgow Coma Scale is an evaluation tool used to determine a patient's level of consciousness. The tool evaluates and assigns point values or scores for eye-opening, verbal response, and motor response. The scores are then totaled, giving you the patient's Glasgow Coma score, which ranges from 3 to 15, 3 being the least responsive. In this scenario, the patient opens his eyes to painful stimuli, receiving a score of 2. His sounds are incomprehensible, gaining another score of 2. The patient withdraws from pain, giving him a score of 4. When you add up the totals, the patient has a Glasgow Coma score of 8, indicating severe dysfunction. Question 2. You and your partner are dispatched for a 45-year-old male who was shot in a drive-by shooting outside his home. The 911 caller is the patient's wife, an off-duty nurse who reports the patient has an arterial bleed to his left upper thigh and that direct pressure is being applied. How do arterial bleeds present? A. Milky white blood that trickles outside the body. B. Bluish-purple blood that spurts in time with the patient's pulse. C. Dull red blood that trickles outside the body. D. Bright red blood that spurts in time with the patient's pulse. The correct answer is D. Bright red blood that spurts in time with the patient's pulse. Arterial bleeding presents as bright red blood that spurts out of the patient's body in time with their pulse. Arterial bleeding from an open artery is bright red because it is oxygen-rich blood. The arterial pressure that makes this type of bleed spurt can be extremely life-threatening as the patient can experience significant blood loss in a short time. When blood trickles outside the body and is bluish-purple, it is generally from a venous bleed where the blood is oxygen-poor. Question 3. You are dispatched to a local high school for a 13-year-old female who was struck in the face by another student during an altercation. Dispatch advises the patient has significant hemorrhaging from her nose and mouth. What does hemorrhage refer to? A. Bleeding. B. Shock. C. Multiple facial fractures. D. Vomiting. The correct answer is A. Bleeding. The definition of hemorrhage is bleeding. When it is reported that a patient has significant hemorrhaging from a part of their body, it means they are bleeding profusely. Hypovolemic shock can occur as a result of significant hemorrhaging, and multiple facial fractures can happen when assaulted in the face, but those conditions are not what hemorrhage refers to. Question 4. You are assessing an 18-year-old male who was ejected from his motorcycle at a high rate of speed. The patient was not wearing a helmet and has significant head trauma. What trauma scoring system is designed for patients with head trauma? A. Multi-System Trauma Score, MTS. B. APGAR score. C. Revised Trauma Score, RTS. D. Glasgow Coma Scale, GCS. The correct answer is C, Revised Trauma Score, RTS. The Revised Trauma Score, RTS, is the trauma scoring system designed for patients with head trauma. The RTS is generally used for patients with head trauma because it is weighted to compensate for significant head trauma without multi-system trauma or major physiological changes. There is no trauma scoring system called the multi-system trauma score. The APGAR score is used to assess newborns 1 minute and 5 minutes after birth, and the Glasgow Coma Scale is used to assess a patient's level of consciousness. Question 5. What are the two most common mechanisms of injury of blunt trauma in adult and pediatric patients? A. Falls and gunshots. B. Assaults and baseball bats. C. Motorcycle and motor vehicle crashes. D. Falls and motor vehicle crashes. The correct answer is D. Falls and motor vehicle crashes. Blunt trauma is a force exerted upon the body that does not break the skin. The two most common mechanisms of injury for blunt trauma in adult and pediatric patients are falls and motor vehicle crashes. Falls can be particularly harmful in pediatric patients because their bodies are top-heavy, and they are at greater risk of striking their heads when they fall. In the geriatric population, falls also contribute to head injuries and hip fractures. Assaults and baseball bats can cause blunt trauma, but they are not the two most common reasons patients sustain blunt trauma to their bodies. Wounds from gunshots fall under the category of penetrating trauma, as the projectile penetrates and breaks the surface of the skin. Question 6. You are called to assist search and rescue, who located a missing hiker. The 42-year-old female patient's lower body is trapped underneath a boulder that fell on her while she was hiking. How long does the patient have before crash syndrome develops? A. 1 hour. B. 4 hours. C. 6 hours. D. 2 hours. The correct answer is B. 4 hours. Crash syndrome develops when a patient has an area of their body trapped for longer than 4 hours. When a patient's tissues are crushed so badly they cannot be repaired, muscle cells die and release harmful substances into the surrounding tissues of the body. When the object is removed from the patient, these toxic substances are released into the body's circulatory system after blood flow returns. When the byproducts of metabolism and the harmful products of tissue destruction are released into the bloodstream, the risk for cardiac arrest and renal failure increases. For these reasons, it is recommended that paramedics administer intravenous fluids to the patient prior to moving the object. Question 7. What type of brain injury is caused when force is applied to the head, and the energy transmission to the brain tissue causes trauma on the opposite side of the original impact? A. Coup-contrecoup injury. B. Deceleration injury. C. Acceleration injury. D. Coordinated injury. The correct answer is A. Coup-contrecoup injury. A coup-contrecoup injury is caused when a patient strikes their head on a fixed object, such as a windshield, and the brain continues to move forward until abruptly stopping when it hits the inside of the skull. As the brain strikes the front of the skull, the body begins moving backward. The patient's head will fall back against the headrest, and the brain is thrown into the rear of the skull. This type of front and rear injury is called a coup-contrecoup injury. The same type of injury can occur in a lateral collision as well. Question 8. As an EMT, you are taught to look and feel for DCAPBTLS on all trauma patients during your assessments. What does the mnemonic DCAPBTLS stand for? A. Deformities, contusions, abrasions, pain, burns, tenderness, lacerations, and swelling. B. Deviations, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. C. Deformities, cuts, abrasions, punctures, burns, tenderness, lacerations, and swelling. D. Deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. The correct answer is D. Deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. DCAPBTLS is one of many mnemonics and acronyms used by EMS professionals. EMTs use this specific mnemonic to remember what to look for when assessing and palpating a patient with injuries or suspected injuries. Question 9. You are on scene with a 75-year-old female complaining of right hip pain after tripping over her dog while on a walk. The patient has shortening and rotation of her right leg with severe pain upon movement and palpation. What is the preferred way to immobilize the patient's hip to prevent further injury during transport? A. Apply a traction splint. B. Use a scoop stretcher and pad the hip with pillows. C. Apply a Kendrick extrication device, KED. D. Place the patient in a stair chair. The correct answer is B. Use a scoop stretcher and pad the hip with pillows. The best way to immobilize patients with a suspected fractured or dislocated hip is to use a scoop stretcher and pad the hip with pillows. Scoop stretchers are an invaluable tool as the stretcher breaks into two pieces and can be slid under the patient, reducing movement of the hip. Traction splints and stair chairs are contraindicated in patients with hip injuries as they can exacerbate the patient's injury. The Kendrick extrication device is used to maintain spinal precautions when moving patients from a seated position to a backboard, but it does not immobilize patients' hips. Question 10. You and your partner arrive on scene with an unknown age male who was stabbed multiple times in the chest and neck. A fire crew arrived 2 minutes before you and initiated CPR. You have a total of 4 first responders to work on this patient. What is the term used for the approach you would take to manage a patient in cardiac arrest? A. The pit team approach. B. The grab-and-go approach. C. The pit crew approach. D. The grab-and-run approach. The correct answer is C. The pit crew approach. The pit crew approach is the method used when there are 4 rescuers to manage a patient in cardiac arrest. The first rescuer will be the team leader, the second and third rescuers will perform CPR, and the fourth rescuer will operate the AED. Some might think the grab-and-run or grab-and-go approach sounds more appropriate, however, the EMT textbooks teach the pit crew approach. The name of the approach is similar to that used in a car race, where pit crews rapidly service the race car when it enters the pit. Looking for more study help? Get additional practice tests, study guides, and flashcards for the EMT test at uniontestprep.com.